A priority for the National Cancer Action Team as we move into this new year of 2012 is to continue to press towards ensuring that the delivery and experience of services for patients with cancer in this country at least matches the best in the world. In recent months, or in fact over recent years, we've made significant progress in terms of the improvement of service delivery and experience, but we still have a long way to go if we're to match the best in the world. As a team, our priorities, I think, would be threefold. One would be to ensure that the lives that are currently being lost unnecessarily are saved in the future, and that's about raising awareness of the public of the signs and symptoms of cancer, but it's also ensuring that we diagnose cancer as early as possible. A second priority would be to ensure that the resources that we have available to us are used in the most effective way. And that means looking at things like investment in early diagnosis. It means less investment in inpatient hospital stay. It means looking at programs such as the Enhanced Recovery Programme, different surgical techniques such as laparoscopic surgery for colorectal cancer. And so as a team we're continuing to identify areas in which improvements in the effective use of resources can be made and ensuring that we support the service in making those changes. And the third area of priority for us is seeing what we can do to improve the experience of patients who are suffering with cancer. We conducted a survey at the end of 2010 which showed again that there were marked improvements in many areas in terms of patient experience of care and treatment. But again, there's still significant variation across the country, and we need to do what we can to improve the experience of patients, and whether that's around communications that patients have with healthcare professionals, whether it's about improving the information that patients have about their disease and their treatment, or whether it's in fact improving the effectiveness in the way in which multidisciplinary teams work. These are the kind of areas that we will continue to work in during 2012. And I think the other area that we will be looking at is improving the quality of life for people that are living with and beyond a diagnosis of cancer. And that's an area that I think has been neglected in the past and an area that we need to give greater attention to in the future.